The pelvis is a basin-like structure. It connects the spine to the lower limbs. It is an important part of a skeletal system. So it transmits the weight of your trunk to the legs. And it takes the weight of the sitting body. It allows movements of walking and running, and it protects the pelvic organs. In addition, the female pelvis is adapted for childbearing with an increased width and rounded brim. It is a skeletal ring that is formed by the two innominate or hip bones and the sacrum and the coccyx. The bony pelvis is formed by four bones united at four joints. The bones are the two hip bones in front and on the sides, and the sacrum and the coccyx behind. Regarding the hip bone, it is innominate bone and it is an example for irregular bone. It consists of or composed of three components, that is the ilium, that is the upper expanded portion, that is the ilium, then lower down, that is ischium, and in front the part of bone is known as pubic bone, and these three bones, they join each other and form the acetabulum. So in this hip bone, you can identify the pubis, you can identify the acetabulum, and there's a foramen, that is obturator foramen, ischium, ilium. In this picture, you can identify the upper expanded portion is ilium, and the upper border of the ilium you already know, that is iliac crest, and anteriorly that is anterior superior iliac spine, and then lower down after following a small notch, that is the anterior inferior iliac spine. Then posteriorly, posterior aspect of the iliac crest, that is posterior superior iliac spine, and then also posterior inferior iliac spine is there, followed by there is a greater sciatic notch, and the medial aspect of the ilium you can see there, that is a pelvic surface. So there is an iliac fossa in front, and that referent area or the auricular surface that comes under sacropelvic surface of the ilium, and this auricular surface is going to articulate with the ala of the sacrum and form the sacroiliac joint. Then lower that portion, that is the ischium, which presents ischial tuberosity, and upper part of this ischium you can see the ischial spine and followed by a small notch, that is the lesser sciatic notch. So ischium have a rami, that is the ischial rami. It joined with the inferior ramus of the pubis and form the conjoined ischiopubic rami. Then anteriorly what you can see is the pubic bone, and the marked part is symphyseal surface or the medial surface of body of the pubis. And the body of the pubis have a body and rami, that is superior rami and inferior rami, and the inferior rami of the pubis is joining with the rami of the ischium and form the conjoined ischiopubic rami. Then you can see that round or oval gap between this ramus and also the anterior part of the ischium, that is known as the obturator foramen, which will be bridged by the obturator membrane. So the pelvic surface of the pubic bone and the ilium and the ischium will be involved in the formation of the bony pelvis. The ischium is the thicker lower part of the hip bone and it has following part. As a tabulum, you can see that is by the union of the three components of hip bone and followed by the lower aspect, the thickened area, that is the ischial tuberosity, and ischial spine, that is also an important part while you study the difference between the male and female pelvis. There is an ischial spine. So its location in the pelvimetry or during the obstetric analysis of pelvimetry, it is important because it is in relation to the fetal head. That means we'll take the interspinous distance, and also that means above or it is fetal head is below or at station. All these things will be taken into the consideration during the internal pelvimetry and or pelvimetric study. Then other one is you can see the greater sciatic notch that extends from the sacroiliac joint that to the ischial spine. That notch is known as greater sciatic notch. And then there is after the ischial spine that extends from ischial spine to ischial tuberosity. One notch is there that you already studied along with the hip bone. That is known as lesser sciatic notch. Then you can identify here the obturator foramen. So obturator nerves and vessels that exit the pelvis through a gap that exists between the along the upper part of the obturator foramen. So there is a groove there, that is obturator groove on that is pubic bone, on the ramus of the pubic bone, and it exists between the gap and the rami, a gap between the rami and the obturator membrane. There will be a gap in the obturator foramen, and the obturator nerves and vessels, they will exit the pelvis. And also regarding the greater sciatic notch, as you already studied that so many structures are exiting internal iliac artery branches, they are also exiting through the greater sciatic notch and to enter into the gluteal region, as well as some structures will exit from the pelvis through the greater sciatic notch, then it again reach the gluteal region, then it again pass through the lesser sciatic notch like pin structures, that is the pudendal nerve, internal pudendal vessels, and now to obturator internus. All these structures again enter into the perineum through the lesser sciatic notch. So these are the things we have to remember while dealing with the bony aspects of the pelvis. Then again the other bone that is involved in the anterior part, that is the pubic bone. So the two pubic bones, it form the anterior part of the hip bone. It has following part, that is it consists of a body and two rami, that is the inferior rami and the superior rami of the pubis. And this body of the pubic bone, the body have a medial surface anterior and a posterior or pelvic surface. Pelvic surface involved in the formation of the bony pelvis, and the medial surface it articulates with the other half or the other pubic bone, and that is the symphyseal surface, and that is known as the pubic symphysis. It is an example for the secondary cartilaginous joint. And between the two rami, so between the two rami of the inferior rami of the pubic bone, they will form an angle. The two inferior ramus, it form a angle that is known as the subpubic angle. It is also important when you consider the sex differences between the male and female pelvis. And the sacrum, that posterior aspect of the pelvis on the midline, the bone that is present is sacrum and coccyx. So sacrum is a wedge-shaped bone that is made up of 5 fused bones, and the prominence, that is sacral promontory, again it will be consideration while determining the sex difference between male and female pelvis. The sacrum is also important, and it is joining with the ilium and sacropelvic surface of ilium and form the sacroiliac joint. Then this expanded portion that is seen on either side of sacropremonitory, that is known as ala of the sacrum, and the pelvic surface of the sacrum or the ventral surface of the sacrum, it is hollow, it is concave, it is concave. So this is also will be, sacrum is also one of the important bone that will be taken into consideration during the sexual difference or sexual dimorphic changes between the male and females. And the coccyx, it is a vestigial tail-like, consists of four fused vertebrae forming a small piece of triangular bone. And it is articulated with the sacrum, and it also moves backwards during the childbirth. As you know, how the bony pelvis is formed, and there are joints existing, as well as there are ligaments that is connecting these pelvic bones together. And one of the ligaments, some of the ligaments is that sacroiliac, between the sacrum and ilium. Then anteriorly you are getting the pubic bone, so there is a pubic ligament. And there is sacrotuberous ligament, that you already seen this ligament before, a sacrotuberous, which is connecting the sacrum and ischial tuberosity. And the other one is sacrospinous. So it is another ligament that is from the sacrum to the ischial spine. And sacrococcygeal. So it is between ligament that is between the sacrum, or one ligament on each side from sacrum to coccyx. So these are some of the important ligaments: sacroiliac, pubic ligament, sacrotuberous, sacrospinous, and sacrococcygeal ligaments. The pelvis is divided by the plane of pelvic inlet or pelvic brim or superior aperture of the pelvis into two parts. The upper part is known as the greater or false pelvis, and the lower part is known as lesser or true pelvis. So the plane of the pelvic inlet passes from the sacral promontory to the upper margin of pubic symphysis. The greater or false pelvis includes the two iliac fossa and forms a part of the posterior abdominal wall. The greater pelvis is comfortably occupied by the abdominal viscera, leaving only the lesser pelvis for the pelvic viscera. Then the lesser or true pelvis, it contains the pelvic viscera, urinary bladder which lies behind the pubic symphysis, rectum and anal canal are close to the sacrum and the coccyx. The middle space is for the genital organs. So many structures cross the brim of pelvis. That means a curved line extending around the pelvis at the junction of the greater and lesser pelvis. False pelvis, which is formed by the upper flared out portion of the ilium. So lateral boundary is iliac fossa. Behind is fifth lumbar vertebra. So this false pelvis comes as a part of the posterior abdominal wall also. So laterally iliac fossa, posteriorly the fifth lumbar vertebra, and anteriorly the abdominal wall and the inguinal ligament will come. So it protects the abdominal organs, and it has no obstetrical importance except that it provides certain landmarks for the external pelvimetry. The true pelvis is the bony canal through which the fetus passes during the birth, and its bony walls are formed anteriorly by pubic symphysis and the bodies of pubic bones. So pelvic surface of the body of pubic bone, then posteriorly by the pelvic surface of sacrum and coccyx, and on each side by the two rami of the pubis. Then again the pelvic surface of ischium with its ramus and the lower part of ilium. So this is the bony wall of true pelvis, and this pelvis can be divided into three parts. One is the inlet, pelvic inlet, otherwise called the pelvic brim, and then it has a pelvic cavity and pelvic outlet. So pelvic inlet is also called as superior aperture of pelvis, and pelvic outlet is also known as the inferior aperture of the pelvis. Pelvic inlet. It marks the junction between this false pelvis or greater pelvis from the true pelvis or the pelvic cavity or lesser pelvis. So what are the boundaries of this pelvic inlet? So pelvic inlet, posteriorly it is bounded by sacral promontory. You know what is sacral promontory? It is the anterior margin or the anterior aspect of the the sacral vertebra. So body of the sacral vertebra, sacral promontory, and anteriorly the pubic symphysis, its upper margin. And on each side the pelvic inlet is bounded by the linea terminalis. So what is this linea terminalis? It is like a continuous line that is extending from the ala of the sacrum, that expanded portion on either side of the body of the first sacral vertebra, the base, that part is known as the ala of the sacrum. So connecting the ala of the sacrum, then you will come across the arcuate line. And what is this arcuate line? It is actually the thick curved ridge that is seen on the anteroinferior aspect of the auricular surface of the ilium. From there up to the iliopubic eminence, that is the arcuate line. Then after that, from the iliopubic eminence, then the next part what you can see is the pecten pubis. Then you will reach pecten pubis is the upper border of your superior ramus of the pubis. Then after that, you can see the pubic crest. That is the upper part of the superior border of the body of pubis. That is pubic crest. So this is the entire thing is known as linea terminalis. So boundary is behind by the sacral promontory, in front is by pubic symphysis, and on each side by the linea terminalis. You can see the landmarks of the brim. As I already mentioned, the medial border of the lower part of the medial border of the ilium. You will come across some points, that is the iliopectineal line, iliopubic eminence. Then followed by the parts of your pubis, that is there is a pectineal line, then it reaches up to the pubic tubercle, then the pubic crest. So it is starting from the sacral promontory, then ala of the sacrum, then sacroiliac joint it crosses, then that line is iliopectineal line along the lower part of the medial border of the ilium, that is arcuate line. Then iliopubic eminence will come at the junction of the ilium and the pubis, a projection you can see there, that is iliopubic eminence. Then followed by the pectineal line or the upper border of the ramus, superior ramus of the pubis is known as the pectineal line. Then read the body of the pubis, the upper border of the body of pubis, that is known as pubic crest. So before pubic crest, lateral to that there is pubic tubercle. Then it raises the pubic symphysis. So this is the pelvic brim. Coming to the pelvic cavity, it is continuous above with the abdominal cavity at the pelvic brim and is limited below by the pelvic diaphragm. And this cavity is curved in such a way that it is first directed downward, backward, then downward and forward. So it take a J shape. It has unequal walls, that is 5 cm anteriorly and 15 cm posteriorly. So the cavity is more roomy or larger in female than in male. Then boundaries. Anteriorly, what you can see is the pubic symphysis and the pelvic surface of the body of the pubic with the rami. And posteriorly, you will get the pelvic surface of sacrum and the coccyx. And on each side, it is formed by the pelvic surface of ilium and ischium. The contents, the sigmoid colon and the rectum, which occupy the posterior part of the pelvis, the urinary bladder, which lies anteriorly, the prostate lies below the neck of the bladder. In between this bladder and the rectum, there is a transverse septum that is known as genital septum, made up of connective tissue. In male, the septum is small. It contains the ductus deferens, seminal vesicle and the ureter on each side. In the female, the septum is large and contains the uterus, uterine tubes, round ligaments of the uterus, ligaments of the ovary, ovaries, vagina and the ureters. The pelvic outlet is also called as the inferior aperture of pelvis. So this pelvic outlet is bounded anteriorly by the arcuate or inferior pubic ligament. So in front there is lower margin of symphysis pubis or pubic symphysis, which is connected by means of arcuate pubic ligament. Posteriorly comes or behind by the tip of coccyx. And this pelvic outlet is diamond shape. So anteriorly the arcuate ligament, pubic ligament, and posteriorly the tip of the coccyx. And on either side, that is ischial tuberosity laterally. So it is diamond shape. It has an anterolateral boundary and a posterolateral boundary. So anterolaterally, you will have the conjoined ischiopubic rami. Then after that comes the ischial tuberosity. Then posterolaterally to the coccyx, that is sacrotuberous ligament. Then the coccyx. So it is a diamond shaped pelvic outlet. So boundaries in front is by the arcuate pubic ligament, behind by the tip of the coccyx, anterolaterally conjoined ischiopubic rami, laterally then ischial tuberosity. Further, posterolaterally you will get the sacrotuberous ligament. So it is mobile on the sacrum. So this coccyx, it is mobile on the sacrum, and the sacrum itself is slightly mobile at the sacroiliac joint. The pubic arch is formed by the ischiopubic rami of the two sides and by the lower margin of pubic symphysis. So which is rounded off by the arcuate pubic ligament. So here on the inferior aspect of the pelvis, if you view the pelvic outlet, you will come across subpubic angle. So that is the pubic arch or the subpubic angle you will see. It is formed by the ischiopubic rami of two sides and by the lower margin of the pubic symphysis. So that is of significance while you study the sexual dimorphism between the male and female pelvis. So that is the pelvic outlet. The importance of the measurements of the pelvis is mainly obstetric, but also forensic and anthropological. Pelvimetry can be done in different ways. One method is pelvimetry is done on the skeletonized pelvis, that is preparing from cadavers. Then clinical pelvimetry are done on living subjects, and there is radiological pelvimetry. The clinical pelvimetry, there are two methods, externally and internally. External pelvimetry has been mostly given up because of its limited value, but it helpful in the diagnosis of gross pelvic contractions. And internal pelvimetry, that is done by digital examination per vaginum by taking some important diameters like diagonal conjugate, intereschial spinous diameter, etc. So it is done by per vaginum. So the diameters of the pelvis, especially in females, is very important. Regarding the dimension of the pelvis in female, we know that the true pelvis is divided into three regions. One is pelvic inlet, other one is pelvic cavity, another one is pelvic outlet. You know the boundaries of pelvic inlet, that is sacral promontory. Then there is linea terminalis to the pubic symphysis. So there is pelvic cavity is there. Iliac surface of pubic bone, ilium, ischium and sacrum is involved in the boundaries of pelvic cavity, and there is pelvic outlet. There it is the lower aspect of the pubic bone, then the ramus of pubis, then ischiopubic rami, ischial tuberosity, and then sacrotuberous ligament and the coccyx tip will come there. So this is the boundaries of pelvic inlet, pelvic cavity and pelvic outlet. So you are taking the diameter, that is anteroposterior diameter, transverse diameter, oblique diameter. These are the three diameters will taken for the dimensions or the female pelvis. Anteroposterior diameter, transverse diameter and oblique diameter. So first consider the pelvic inlet. So the anteroposterior diameter is also called as true conjugate. It is an anatomical conjugate. So it's posteriorly, in the case of pelvic inlet, the bone that you found is the sacral promontory, and anteriorly you will get the pubic symphysis. So connecting these two, that is the midpoint of sacral promontory to the upper border of pubic symphysis, that is anatomical conjugate or true conjugate, that is the anteroposterior diameter. In the case of female, the pelvic inlet, the anteroposterior diameter is 11 centimeter. The next is transverse diameter, that is the maximum transverse diameter obtained, that is the transverse diameter, that is 13 centimeter. The next one is oblique. From the name itself, it is oblique from one point to the other. So in the case of pelvic inlet, pelvic brim, if you take the pelvic brim, you know that after the sacral promontory, then the ala of the sacrum will come. Then you will have this linear terminal, or the arcuate line is there. Then iliopubic eminence. After that, the pectilean line. So one point is the iliopubic eminence to the opposite sacroiliac joint. That means if you are taking the right iliopubic eminence, the other point, that is next point, is on the left sacroiliac joint, so oblique. So it is 12 centimeter in the case of pelvic inlet. The next is pelvic cavity. In the pelvic cavity also, we are considering the three diameters, that is anteroposterior, transverse and oblique. So in anteroposterior diameter, it is from S3 vertebra, that is the midpoint of sacral vertebra, third piece of sacral vertebra, that is S3, to the posterior surface of pubic symphysis, that is the pelvic surface of pubic symphysis. So that is the anteroposterior diameter. The next is transverse diameter. That is the maximum diameter obtained transversely. Then next one is oblique. So it is from the lowest point of one sacroiliac joint to the midpoint of the opposite obturator membrane. So from sacroiliac joint of one side to the lower point of the sacroiliac joint of one side to the midpoint of the obturator foramen, obturator membrane on the other side. So that is the oblique diameter. In the case of pelvic cavity of female pelvis, both these three diameters are 12 centimeter. The next is pelvic outlet. Again, in the pelvic outlet, remember the boundaries of pelvic outlet. So here what you can see is anteroposterior diameter. So in the pelvic outlet, the posterior boundary is the tip of coccyx. So the anteroposterior diameter, it is from the tip of coccyx. So anteriorly again, you are getting the inferior margin of pubic symphysis. So from tip of coccyx to the inferior margin of pubic symphysis. Then transverse diameter is bituberous. That is, you are getting laterally two ischial tuberosities. So measuring that. That is the transverse diameter. Then there is oblique diameter is there. Oblique is from the sacrotuberous ligament, midpoint of sacrotuberous ligament on one side to the junction of the ischiopubic rami on the other side. So it is from one side to other side. Midpoint of sacrotuberous ligament on one side to the junction of ischiopubic rami on the other side. So a anteroposterior diameter is 13, transverse diameter is 11 and the oblique diameter is 12. So if you carefully observe that the anteroposterior diameter, inlet, cavity, outlet, what you are seeing is it is in an ascending order, that is 11, 12, 13. So you can write inlet, cavity, outlet 11, 12, 13. And if you see again regarding the transverse diameter, it is in decreasing order, that is 13, then 12, then 11. And oblique diameter in the case of 3, that is inlet, cavity, outlet, that is 12 centimeter in length. So these are the measurements or the dimension of the female pelvis. So in this diagram you can see the anteroposterior diameter anatomical conjugate from the middle of sacral promontory to the upper margin of pubic symphysis, oblique diameter from sacroiliac joint of one side to the iliopubic eminence of other side, and the widest of all diameter is the transverse diameter. This is for your information regarding the conjugate, that is pelvic brim. As you know, it is from the sacral promontory to the pubic symphysis. There is a diagonal conjugate, obstetrical conjugate and true conjugate. True conjugate, as you already seen, it is extending from, or anatomical conjugate, you can see it is extending from the middle of sacral promontory to the top of the pubic symphysis, and its normal measurement is 11 centimeter. If you take the obstetrical conjugate, it is a distance between the midpoint of sacral promontory to prominent bony projection in the midline of pubic symphysis. It measures around 10 centimeter. If you are taking the diagonal conjugate, the distance between the lower border of pubic symphysis to the midpoint on the sacral promontory, that is called as diagonal conjugate. That is from the midpoint of sacral promontory to the lower border. The true conjugate, it is from the midpoint of sacral promontory to the upper border or the top of the pubic symphysis. So this just keep in mind regarding this. There are anteroposterior diameter. In addition to the anatomical conjugate, you can consider this in three ways. Three types are there. That is diagonal conjugate, obstetrical conjugate, and true conjugate. Again in this regarding the pelvic cavity, anteroposterior diameter is from the middle of the back of the pubic symphysis to the pelvic surface of the third sacral vertebra. And oblique diameter is from the lower end of sacroiliac joint of one side to the center of obturator membrane on the other side, and transverse diameter across the lateral bony walls of the pelvic cavity. In the case of pelvic outlet, again you can see the boundaries of pelvic outlets. So anteroposterior diameter is from the lower border of pubic symphysis to the tip of the coccyx. Oblique diameter between the junction of ischiopubic ramus of one side to the middle of the sacrotuberous ligament on the opposite side, and transverse diameter between the medial surface of the lower end of the ischial tuberosities. We can classify the pelvis into different types. So the morphological classification of pelvis can be in two ways. One is according to the pelvic brim index, and the other one according to the anatomical and radiological data. According to the pelvic brim index, we can call it as dolichopelvic, platypelvic, mesatipelvic, and brachypelvic. Otherwise, according to our anatomical and radiological data, we can divide the pelvis into gynecoid type, anthropoid type, anthroid type, and platypelloid type. The first type is gynecoid type. It is around 50% or 41.4%, around 50% population. They have the gynecoid type. It conforms to mesatipelvic. Then what is mesatipelvic? I already mentioned, depending upon the pelvic brim index or pelvic inlet index, depends on the conjugate diameter and transverse diameter, it is calculated. According to that, this gynecoid pelvis is mesatipelvic. So what is this mesatipelvic is that if the transverse diameter is greater, slightly greater than the conjugate diameter. Conjugate diameter is anteroposterior diameter, or the inlet diameter, this anteroposterior diameter, it is slightly less, or the transverse diameter is slightly greater than the conjugate diameter. Okay, that is transverse diameter is slightly greater than the conjugate diameter as in normal females. So that variety is known as mesatipelvic. So gynecoid pelvis is mesatipelvic pelvis depending upon the index. And this is more suitable for childbirth. And it is wider brim and ischial spines are blunt and subpubic angle is around 90 degrees. So this type of pelvis. And the inlet is round or slightly ovoid with transverse diameter placed well forward from the sacrum. And the side bones of this type of pelvis are more vertical than in anthroid pelvis. So this type is known as gynecoid pelvis, which is more suitable for the childbirth, and this is a normal female pelvis. The second type is anthropoid type, that is around 23.5 to 25%. It conforms to the other variety, that is dolichopelvic. And I already mentioned dolichopelvic. Uh, when we consider the pelvic brim index, what do you mean by dolichopelvic is that when the conjugate diameter is greater than transverse diameter. When the conjugate diameter is greater than transverse diameter, that is dolichopelvic. So this anthropoid type conforms to dolichopelvic pelvis, and it resembles to the pelvis of anthropoid apes. So the conjugate diameter is greater than the transverse, but the subpubic angle and the greater sciatic notch are wide. And it is oval in shape, this type of pelvis. It favors a posterior position of fetus, and it is seen in tall women with narrow shoulders. The anthroid type of pelvis or brachypelvic, it resembles a male pelvis. The inlet is triangular with the greatest transverse diameter is much placed near the promontory. It is near to the promontory than in gynecoid pelvis. In gynecoid pelvis, the transverse diameter is more placed anteriorly. In the male pelvis, the transverse diameter, greatest transverse diameter placed much near the promontory than in gynecoid pelvis, and the subpubic angle and the greater sciatic notches are narrower, so that the cavity is funnel shaped and the outlet is reduced in all diameters. So childbirth is difficult in this type of pelvis, and the pelvic brim is heart shaped. So the anteroposterior diameter is shorter. Platypelloid pelvis or platypelvic. And what do you mean by platypelvic? It is the transverse diameter is much greater than the conjugate diameter. Much greater than conjugate diameter. So you will get the kidney shaped brim, and this is rare, 2.5 to 5%. And transverse diameter is much greater than transverse anteroposterior diameter. And in this type, the conjugate diameter is reduced and other diameters are normal. Out of the various types mentioned, only a gynecoid pelvis permits a normal delivery of the child. The other three represent different types of contracted pelvis. In this category, we can also include a generally contracted pelvis, which is a small gynecoid pelvis as seen in the short-statured woman. Many bony differences are shown in male and female, and this can be used to determine the sex of skeleton of unknown origin. The most marked of these differences are to be seen in the pelvis. As compared to the male pelvis, a female pelvis shows the following differences. First, if you consider the general build, the bones of the female pelvis are lighter and thinner, and the bony markings are less prominent as compared to the male. Then, the articular surfaces, acetabulum, and the body of the first sacral vertebra are smaller in size. If you come to the ilium, then the next is in the blades of that, in the case of female pelvis, there are more vertical but smaller in height. The iliac crests are smoother and less curved because the muscular attachments are more prominent in the case of male, so that the iliac crests are smooth and less curved. Then the iliac fossa are shallower in females. So because of the vertical alignment of the blade, the diameter between the two iliac crests, that is the intercrestal diameter, that is also small in the case of female as compared to male. When you coming to the pelvic inlet, in female the inlet is larger and more circular. The transverse diameter is placed well forward from the promontory. In the male, the transverse diameter is placed, maximum diameter is placed near the promontory. Pubic crest is longer in the case of female, so that the pubic tubercles will also be wider apart in the case of female. The next is regarding the body of first sacral vertebra. It is less wider compared to that of male. It is less wider, that is, it is forming only 1/3 of the base, because the ala are relatively wider in the case of female. In male, it forms this ala, this base of the S1 vertebra, it forms more than 1/3 of base. So almost ala of the sacrum and the base of S1 almost equal in size will come, the width. But in the case of female, ala is more wider than the size, than the width of the first sacral vertebra. Then the next is pelvic outlet. You can see that outlet is much larger in the case of female than in males. And subpubic angle, that is between the two rami of the pubis. So the subpubic angle is wider and it is around 80 to 85 degree in the case of female. It is less in the case of male, that is 50 to 60 only it will come. And if you consider the ischiopubic rami, you can see that it is thinner and slightly everted in the case of female. But when you come to the male, it is rough and is markedly everted for the attachment of the pars penis. Then the ischial tuberosity, in the case of female, they are more everted and the coccyx is more vertical, and all these are necessary for the passage of baby or the delivery. Then the next is sciatic notches. There are two sciatic notches, greater and lesser sciatic notch. First you take the greater sciatic notch. It is wider in female and it is about 74 degree, and that is due to the increased backward tilt of the sacrum. In the case of male, it is about only 50 degree. And along the upper margin of the greater sciatic notch, there is a sulcus. When you study the hip bone, you come across a sulcus, that is preauricular sulcus. And it is deeper in the case of female. And then you see, after the greater sciatic notch, you can see the ischial spine. And the ischial spines are wide apart in the case of female. After that, the next notch, what will you see, is lesser sciatic notch. It is also wider in the case of female than in the case of males. Coming to the pelvic cavity, in male, the cavity is longer and more conical, like a long segment of a short corn. In female, the cavity is short and more cylindrical, like a short segment of a long corn. So, in the case of female, the cavity is shorter and more cylindrical. In the case of male, the cavity is longer and more conical. Consider the anteroposterior diameter. It is much greater than in male due to the increased backward tilt of sacrum. And if you see the pelvic walls, in the case of female, the walls are more vertical. so that the difference in the sizes of inlet and outlet is smaller. So there is no much difference existing in the size of the inlet and the outlet because of the vertical orientation of the wall of the female pelvis. But when you come to the male, this wall is converging, the pelvic wall is converging inferiorly so that the inlet is larger than the outlet. So just like a port, it will happen in the case of males. Coming to the sacrum is short and wide in the case of female, and it is more tilted backward, and the concavity is also deeper in the case of female. So in the case of male, it is more longer and shallow. The concavity is shallow in the case of males. Regarding the obturator foramen, it is smaller and triangular in the case of female. It is large and oval in the case of males. Coming to the acetabulum, it is smaller in the case of female. That means its transverse diameter of the acetabulum is lesser than the distance between the anterior margin and the pubic symphysis. So the distance between its anterior margin and the pubic symphysis, compared to that, the transverse diameter is less. So that's why the acetabulum is smaller and it faces more forwards. And anterior wall, if you take the anterior wall, the height of the anterior wall of the pelvis is smaller in the case of females. So these are all the differences that exist between the male and female pelvis. If you see the orientation of the pelvis with the body in the upright position, the anterior superior iliac spine and the superior part of the pubic symphysis or the pubic tubercle, they are in a vertical plane. So, the pubic symphysis and the anterior superior iliac spine, which lies in the same coronal plane. So, if we fix the pelvis taking a wall or any plane surface, we can see that the anterior superior iliac spine and the pubic symphysis should come in the same coronal plane or a vertical plane. And the pelvic surface of the body of the pubis, which is directed upward and backward. It should not be vertical and backward. It is facing upward and backward. Then the other thing is the symphysial surface of the body of the pubis or the medial surface of the body of the pubis also lies in the medial plane. So the pubic symphysis and the anterior superior iliac spine should lie in the same coronal plane. So we can touch both these ends on a wall. Then the pelvic surface of the body of the pubis, that should be directed upward and backward. And the symphysial surface of the body of the pubis should lies in the same median plane. These points we have to remember while dealing with the hip bone as well as with that of your bony pelvis. So we can see that the acetabulum, it faces infrolaterally with the acetabular nodes that is directing inferiorly. Inframedial to that, again the position of obturator foramen. Then the internal aspect of the body of the pubis, that is directing upward or superiorly and backward, and where the urinary bladder rests. And in the anteroposterior view, you can see that the inlet is more vertical than horizontal, with the tip of the coccyx appear near its center. So thank you.